3D organ bioprinting is the use of 3D printing technologies to assemble multiple cell types or stem cells along with other biomaterials in a layer-by-layer formation to create bioartificial organs that ideally imitate their natural counterparts. 3D printing medical devices allows healthcare providers and medical device manufacturers to design custom devices that match a patient's exact needs and physical anatomy. Despite the rapid development in medicine in the last several decades, the only available cure for organ failure is getting an organ transplant, which has serious limitations due to a shortage of organ donors, lifelong immune rejection, and ethical conflicts. According to Jennifer Lewis, a professor at Harvard University's Wyeth Institute for Biologically Inspired Engineering, the driving force behind this innovation of regenerative medicine is real human need. Currently, there are 105,800 men, women, and children on the national transplant waiting list. 17 people die each day waiting for an organ transplant. 40,000 plus transplants were performed in 2021, and every 10 minutes, another person is added to the transplant waiting list. While bioprinting technology is still in the development stage, it has already passed the apologetic stage with successes in human and animal model bioprinting. This means that doubts about the possibility of implementing bioprinting have been dispelled, successes of using the technology for bioprinting tissue and organs have been demonstrated, basic techniques and methods have been worked out, and a number of technical restrictions for implementing the technology have been overcome. Despite bioprinting technology completing its first stage, there is currently no unique regulatory framework governing the entire bioprinting process. It is important to pay attention to the speed at which these technologies develop to identify and study ethical problems before 3D bioprinting is ready for widespread use in patients. The Food and Drug Administration regulates medical devices based on the intended use of the product and the potential risks posed to patients. Although the FDA does not regulate 3D printers, the medical devices made using 3D printing are subject to FDA oversight. Some ethical risks involved in 3D bioprinting include data exchange for research purposes, increases the number of individuals who can access personal medical data, which then increases the likelihood of data leakage and creates opportunities for malicious use. Because the technology in bioprinting is set by a digital model, the printed organs will replace the natural ones, and therefore models will replace nature. This leads to a question of responsibility for the development and evaluation of the 3D models. Who and to which extent will be responsible for the translation of the anatomical image into digital format? The designers, biologists, or programmers? Who will have the legal rights for the model? Will it be possible to use the model without a patient's consent? And is it possible to apply the models commercially? Confidentiality and privacy should also be addressed due to the digital 3D model representing personalized human data. This information needs to be considered private, and special rules regulating the receipt, storage, handling, processing, and application of such information should be addressed in the regulatory framework and required. The key aspects of bioprinting management include the risk regulation and responsibility for product quality. This raises issues that should be addressed in a proposed regulatory framework, such as who is primarily responsible for the quality of bioprinting products, the 3D bioprinting providers or medical organizations. Who should be responsible for quality control? Who should be liable in case of bioprinted organ quality claims from the recipient? One of the major challenges to the development of 3D printing of organs is the close coordination and integration of skills that is required in many fields of science and technology, such as cell biology, computer, chemistry, mechanics, engineering, manufacturing, and medicine. Expertise from 3D model designers, medical professionals, lawyers, engineers, biologists, members of the ethical committee, and insurance companies are necessary for multi-stakeholder collaboration to form an acceptable path for the bioprinting technology development and introduction into clinical practice. The scope of legal regulation of 3D bioprinting action includes a wide range of intellectual property rights, including patents, copyrights, design rights, and trademarks. Some specialists may be permitted to commercialize the products in the field of bioprinting because the final product of tissue engineering is so far from its original source as human biomaterial. Therefore, the turnover of these products cannot be considered as commercialization of the human body or its individual parts. This is because of bioprinted human organs having objective features that distinguish them from human organs. They are created artificially, and the creative process is purposeful and controlled. They are formed outside of the human body, and there are no significant risks to life and health of the cell donor during the biofabrication of artificial organs. Moreover, the informed consent concerns only the production of biological material, but not biofabrication of the organ itself. These traits of 3D bioprinted organs before their transplantation to the human body might allow them to relate to objects of civil rights, which therefore may permit the commercialization of the creation and utilization of biofabricated organs. After implantation of organs and tissues, however, they should be recognized as an integral part of a human body, recognizing the legal death of the organ and the termination of title ownership. The two fundamental principles of human rights protection in the field of biomedical research are informed consent and confidentiality. In Moore v. Regents of University of California, 1990, despite the patient plaintiff not being able to retain an ownership interest in the cells taken by the doctor on a cause of action based on conversion, the court held that the case may be prosecuted based on theories of a breach of fiduciary duty or lack of informed consent. In conclusion, 3D bioprinting of organs for regenerative medicine is one of the most rapidly developing and promising areas of biotechnology. Government intervention in research and new technologies development is essential because it will determine the future of technology. 3D bioprinting technology can save lives and revolutionize the medical field. Therefore, it deserves special attention and development of an appropriate legal framework.